welcome to the podcast. I'm Mark Graban from KaiNexus, and today we are doing a quick preview of a webinar panel discussion that we'll be hosting on September 22nd at 1 o'clock Eastern. It's titled How Lean and Continuous Improvement Can Help You Get More Nimble and Adaptive in a Pandemic and Beyond. So if you'd like to register for that, you can do so at www.kainexus.com/webinars. And if you're listening to this after September 22nd, you'll be able to find the recording of the panel in our YouTube channel and our webinar library. So I thought we would just go around the horn and let our panelists introduce themselves real quick, starting with you, John Toussaint.
Thanks, Mark. Yeah, I'm an internist. I ran a healthcare system, integrated healthcare system for many years, and started applying lean principles back almost 20 years ago now. So I've had the chance to work with or visit over 250 different health systems in 19 countries now. And I'm a student of the game, and it's been fun to see how different organizations apply these principles. And, you know, if you've seen one lean transformation, you've seen one lean transformation. But we can learn from everyone, and that's really what we're going to hopefully cover in the webinar.
Great. It's also worth mentioning or reminding the audience that John has a new book out, co-authored with Kim Barnes, called Becoming the Change. So you can go and check that out. So congratulations on that, John.
Thank you.
So we'll continue going around. Skip Steward, if you can introduce yourself also.
Yeah. Hi, my name is Skip Steward. I'm the Vice President and Chief Improvement Officer for Baptist Memorial Healthcare, a non-for-profit healthcare system headquartered in Memphis, Tennessee. And we have hospitals and clinics and a lot of work going on in Tennessee, Mississippi, and Arkansas. I'm looking forward to be a part of this panel, more for what I get to learn than anything. And I'm just very thankful and honored to be a part of this.
Well, thanks, Skip. And I'll mention your book while we're at it. Skip is co-author of a book called Creating an Effective Management System, and that's co-authored with Brad Parsons and Patrick Grau. So you can also find that on Amazon as well. So thank you, Skip. And then Greg Jacobson.
Hello, I'm Greg Jacobson. I'm a ER doctor that was introduced to Kaizen and lean concepts back in 2004 when I graduated from residency. And after applying them in an emergency department, teaching them to residents, I got really interested in how technology could help facilitate the right behaviors and create the right methodologies. And so I co-founded KaiNexus. We're a software company that helps organizations to create cultures of continuous improvement. Been doing that for about 10 years now. And we have about 100 organizations in pretty much every industry you can think of that are using our software. And we feel very passionate about continuous improvement. And so we love bringing people together, smart minds, and the people that are kind of pushing the forefront together. So I don't know why you asked me, Mark, but I'm happy to be a part of the crowd, and I think we'll have a lot of fun when we do our panel.
Well, thanks. Yeah, I agree. It's going to be fun. And just to kind of help tease the topic, we'll have a chance to explore this much more deeply. And if you attend live, you'll be able to submit questions. But we'll just kind of go around once more, play a little bit of quick word association of the first thought or story that comes to mind when you hear the words lean, nimble, and adaptive. John, can I ask you to go first?
Well, improvement starts with standards. So without standard work, you can't improve anything. And I think what's interesting is, standard work kind of gets a bad name, especially with clinicians. But you know what? I mean, a lot of what we do is based on standard work, and we got that standard work from evidence from placebo-controlled trials on the clinical side. The problem on the management side is we don't have any standard work, or many of us don't, and so how can we improve anything that we're doing from a management perspective? So I think we really need to step back and say, what are our management standards so that we can improve them and become more nimble? And we have a lot of examples now through the COVID crisis of healthcare organizations that did have standard work for their management system and how they have really done so much better than those that didn't. And in terms of the ability for them to really act quickly by gleaning ideas from the frontline staff and making decisions immediately on the front line. And that's really what a lean management system is all about. So I think, there's some oxymorons here, but the reality is that we got to have a standard before we can improve anything.
Thanks, John. And Skip, and we'll have a chance to talk about this in more depth during the webinar. But can you share a thought from what you've seen and helped lead at Baptist, how lean, nimble, and adaptive, how those words fit together, what you're experiencing?
Yeah, I think I would build on Dr. Toussaint's comment around standardization and specifically using that to give people the permission to experiment, to study and adjust as they're coming along, both a standard outcome as well as a standard method to produce that standard outcome. And how do we experiment and give people the opportunity to be creative as they're experimenting their way forward to improve patient care?
Thanks, Skip. And Greg, I guess I'll throw the same words at you. Lean, nimble, adaptive, what comes to mind?
Yes, so I'm really just going to riff on what I just heard. Number one, the thought that came to mind before I heard what everyone's going to say was that design really takes form once there's constraints. Without constraints, you really can't start designing. And so that's something that has become really obvious for me over the last 10 years, designing and building software. And then to kind of look at the pandemic as a set topic, one of the major problems that we have right now is we are 6 months in and we have very few randomized controlled trials to guide us. I mean, talk about a lost opportunity that we didn't have and we don't have. We have some that are really good, but just the volume that we have is much smaller than one would hope for. And it's really kind of crippled us into figuring out what are the right things to do. And then the third thing I'll say is, I grew up in a time when the electronic medical record was just coming into fruition. I trained at Vanderbilt and I did medical school at Ben Taub and Baylor, and everything was on paper there. I transferred to Vanderbilt. They were very early on in the process of putting all this into order sets. And so I have never viewed order sets as a constraint. To me, I want to think about all the soft aspects of medicine. We talked about empathy before we hit the record button. We talked about, the practice of medicine, bedside manner, the things that can be memorized, and I can get, the ID doc to tell me what's the best antibiotic in this situation. I don't want to think about those things. And so to me, in many ways, standards and order sets or the way we do things can really free up creativity to add value where humans can really add value into creativity. So there's definitely an oxymoron. There's a juxtaposition that in constraint comes flexibility. But I think that if you start thinking about things in that way, you're just going to sit over and over and over in life and see that pattern. So it's going to be, I think it'll be a really fun panel. So yeah. I'm looking forward to it.
Yeah, I think that connection between standards and flexibility is maybe unintuitive or counterintuitive until people get deeper into lean practice. And our panelists, John, Skip, and Greg, all have that depth of experience that we're going to continue tapping into during the full panel discussion. So again, that's titled How Lean and Continuous Improvement Help You Get More Nimble and Adaptive in a Pandemic and Beyond. We'll look forward to whenever the and beyond hits us, because this need for agility and adaptability is still going to be there. So again, this is going to be September 22nd, 1:00 Eastern. You can register at KaiNexus.com/webinars. Again, we'll be joined by John Toussaint, Skip Steward, Greg Jacobson. Thank you all for being here to do the preview today.
Thank you.
Thanks.